This can be achieved in two primary ways: through intense exercise or by dietary management. Hi, I'm Dr. Sunil Nair. I'm an endocrinologist with a special interest in management of complex obesity and insulin resistance. I work in Chester in the United Kingdom. My practice is at the Countess of Chester Hospital and also at the Nuffield Hospital in Chester. Now, today we're discussing the link between four major health conditions: obesity, type 2 diabetes, fatty liver, and polycystic ovary syndrome. These conditions might seem unrelated, but they share a common thread, which is insulin resistance. Let's explore what this means, and most importantly, what can we do about it? Now, what is insulin resistance? Put simply, insulin resistance occurs when your body stops responding effectively to insulin. Insulin's job is to help glucose enter your cells to be used as energy. But when your cells resist insulin, glucose builds up in your bloodstream, leading to high glucose levels. Insulin is also known to have effects such as reducing fat breakdown and stimulation of ovaries to produce androgenic or male pattern hormones. Now, brain insulin resistance has also been shown in animal studies to interfere with ovulation. Over time, this can contribute to obesity, fatty liver, type 2 diabetes, and polycystic ovary syndrome. Now, what can we do about insulin resistance? Insulin resistance is inherited and is prevalent in a high proportion of most urban populations. However, the good news is that it is not static, it is dynamic. While we can't change our genetics or advancing age, we can influence insulin resistance by managing two key factors: adiposity, which is your body fat, and activity levels. The biggest improvement in insulin resistance comes from maintaining low insulin levels over a prolonged period every 24 hours. This can be achieved in two primary ways: through intense exercise or by dietary management. We know that intense exercise isn't always feasible for many patients with these conditions, particularly as we enter middle age and advanced age. Our reliance needs to shift more and more towards dietary interventions from intense exercise. Now, are there any practical dietary interventions available? Now, this brings us to two practical and effective strategies: fasting and low carbohydrate intake. There are obviously communities of people who have successfully adopted one of these strategies. On their own, both can be challenging, but in my experience, many patients achieve incredible success when they combine these strategies in a manageable way. The real point here is sustainability. You must find a strategy that you can sustain for a prolonged period. For example, maintaining a 14-hour overnight fasting window is surprisingly doable. Simply stop eating at 6 p.m. and avoid consuming anything until 8 a.m. the next morning. During your eating window, focus on low carbohydrate intake, ideally between 50 to 80 grams of carbohydrate per day. This approach helps keep glucose and insulin levels low, giving your body the reset it needs. Now, these strategies are practical, sustainable, and can lead to remarkable improvements in insulin resistance and the conditions associated with it. Before you make any significant changes to your diet or lifestyle, it's always helpful to consult a physician who understands metabolism and is experienced in managing conditions like obesity, diabetes, fatty liver, or polycystic ovary syndrome. And if you're on medications for diabetes or hypertension, the dosages of these medications will need to be adjusted to avoid hypoglycemia or low blood pressure. Remember, consistent changes can lead to improvements over time. Thank you for watching, and here's to better health.